Mr. President, when Congress began debating health care in 2009, the goal was to lower the cost of care and to give Americans the care they need from a doctor they choose. Americans were promised that if they liked the insurance they had and the doctor they had, they would be able to keep the plan and to continue to see the doctor that they liked. Americans were promised that the negotiations would be transparent and televised on C-SPAN. Americans were promised that the bill wouldn't add a dime to the deficit and that it would lower the cost of care. Americans were promised that their premiums would go down by $2,500. Americans were promised that this president would not raise taxes on families with incomes below $250,000. Instead, Congress passed a massive governmental takeover of the healthcare industry. In the last 2 years, we've seen that Americans can't keep the insurance they had, continue to see the doctor they like, and are paying more for health care now than they would have if this administration had not pushed through the massive 2,700-page bill. The law adds billions to the deficit, and at the end of the day, Americans will find that they are left holding a bag full of empty, broken promises. Today, Mr. President, I want to focus on the broken promises on taxes. The President pledged not to raise taxes on individuals making less than $200,000 and families making less than $250,000 per year. Yet the new individual mandate tax, which the Supreme Court affirmed as a tax increase, will raise $54 billion in new taxes, largely on middle-income Americans between 2015 and 2022. In fact, according to the Congressional Budget Office, 77% of those projected to pay the tax in 2016 will be those earning less than $120,000 per year. Americans earning less than $120,000 clearly meet the President's definition as middle income. The Congressional Budget Office projections confirm that at least 3 out of every 4 Americans subjected to the new individual mandate tax will be the same middle-income taxpayers that President Obama promised would not see their taxes raised by 1 dime. In fact, when asked by George Stephanopoulos of ABC News in September of 2009 if the President rejected the notion that the individual mandate was a tax, the President stated, and I quote, "I absolutely reject that notion," end quote. The President wasn't equivocal, and he didn't leave any room for interpretation. So let's be clear. This President and the Democrat leaders here in Congress sold Obamacare as if it did not contain significant new tax increases on the middle class. Yet we now know that what they're really selling was an incredible bait and switch. They were in fact enacting $54 billion in new individual mandate taxes, primarily on the middle class, by calling it something else. I would note that this tax increase is larger than the Buffett rule tax increase that the President has spent much of the year promoting. The Supreme Court ruled that the individual mandate is not constitutional under either the Commerce Clause or the Necessary and Proper Clause of the Constitution. So there are only 2 options. Either the individual mandate is a tax, and it happens to be a tax that falls hardest on the middle class, or it's unconstitutional. It's estimated that the average tax on an American subject to this new tax increase will be about $1,100 per year. And after paying this tax, these Americans still won't have health insurance. We should not forget that the national health insurance tax is not the only tax increase in Obamacare affecting individuals. Starting next year, individuals will be able to save less money tax-free in flexible spending accounts to pay for their own health care expenses. Currently, there's no statutory limit on FSA contributions, though many FSAs set their own limits. Starting next year, Obamacare will cap the amount that Americans can save in a flexible savings account at only $2,500 per year. And Obamacare will limit tax deductions for those with the largest health care needs by reducing the medical expense deduction from expenses above 7.5% of adjusted gross income to expenses above 10% of adjusted gross income. So at the very time that Obamacare is driving up health care costs, it is also making it more difficult for American families to pay for their own health care needs. These tax increases don't even take into account the new 3.8% tax increase on investment income or the almost 1% Medicare surtax that will be imposed on higher-income Americans starting in 2013, making it more expensive for small business owners to hire new workers or otherwise invest in our economy. These taxes on individuals are in addition to the Obamacare taxes on businesses, such as the new medical device tax or the tanning tax. We know that these taxes on businesses will ultimately be passed through to consumers of health care, driving health care prices even higher. In fact, of the $552 billion in new taxes included in the Obamacare, according to the Joint Committee on Taxation and the Congressional Budget Office, the Joint Economic Committee has estimated that roughly $250 billion are tax increases that will hit the middle class, either directly or through the health care products that they consume. In addition to this new national health insurance tax of $1,100 a year and other tax increases in Obamacare, Americans will see that health care costs will continue to rise. Despite the President's promise that his health care plan would reduce insurance premiums, premiums have increased by over $2,200 since Obama took office, according to the Kaiser Family Foundation. And according to the President's own actuary at the Centers for Medicare and Medicaid Services in a report from this month on national health expenditure projections, premiums under the new health care law will rise faster than if we had done nothing at all. And I want to quote from that very report. It says, and I quote, in 2014, growth in private health insurance premiums is expected to accelerate to 7.9%, or 4.1 percentage points higher than in the absence of health reform, end quote. Now think about that, Mr. President, what's actually being said here. That the cost of health insurance would have gone up a lot less per year had we done nothing than what we did with this bill, which is to increase those expenditures for health care by about 7.9%. Americans are going to be stuck paying higher costs for health insurance, medical devices due to the tax on these sectors that this bill imposes. Americans know firsthand that we're going to continue to struggle with an economy that's not performing well. We've got an unemployment rate that remains at 8% now for 41 consecutive months. Now on the immediate horizon, the American people stare down an enormous tax increase from a health reform law that they didn't want and still don't want. Americans are also seeing this law has impacted our economy. According to a recent poll, 48% of businesses that are not currently hiring list the potential cost of health care regulations as a reason for not seeking new employees. And according to the Congressional Budget Office, Obamacare will mean 800,000 fewer jobs over the next decade. The last 3 years have made it very clear that Obamacare is making our economy worse by driving up costs and discouraging job creation. Moving forward, Congress needs to start by repealing Obamacare. We need to repeal Obamacare and enact common sense, step-by-step reforms that protect Americans' access to the care that they need from a doctor they choose at a lower cost. And Republicans will not repeat the Democrats' mistakes. We will not rush to pass a massive bill that the American people don't support. We need to do this the right way. No backroom deals or 2,700-page bills that no one has read. This president owes it to Americans to admit his broken promises and to work with Republicans to put in place real health care reforms that will actually help lower health insurance costs for individuals and families and ensure that Americans can get the care they need when they need it. Mr. President, the taxes that I've mentioned in the health care law are going to add up to a massive tax increase on average, ordinary Americans, and all the analysis that's been done by the Joint Committee on Taxation, the Congressional Budget Office, the Joint Economic Committee, comes to that very same conclusion. This is a tax that's going to hit middle-income Americans, notwithstanding the President's promise that he wouldn't raise taxes on those making less than $200,000 a year. 75% of that tax burden in that individual mandate tax, which is $54 billion, as I mentioned, will hit those making less than $120,000 per year. And so the whole idea of promises made, promises broken, I think is the narrative that's attached itself to this health care reform law, Mr. President. And I would submit that the United States Congress and the President need to work together to repeal this law and to work, as I said, in a constructive way to put in place common sense, step-by-step reforms that actually will drive the cost of health care down for Americans, because that is the one thing that Americans, as they look at the health care economy today, want to see. They want to know that their costs are going to go down rather than up. We continue to see these increases in premiums year over year over year, and it continues to affect our economy. And the mandates that are imposed upon employers in this health care law as well are going to lead to fewer jobs. That is the result, the outcome, if you will, of this health care law, Mr. President. It's higher cost for Americans, as I pointed out, and it's going to mean fewer jobs for American workers. And now, coupled on top of that, we have, as recently as yesterday, the President coming out and saying that he now wants to raise taxes on those small businesses in our country. The tax that he's proposed on those making more than $250,000 a year, interestingly enough, hits 940,000 small business owners. 53% of the pass-through income would face higher taxes as a result of the proposal that he made just yesterday. And the people who run those businesses employ 25% of the American workforce. And so we're talking about huge new burdens on our economy at a time, Mr. President, when we just absolutely cannot afford it. 41 consecutive months of 8% or higher unemployment, 23 million Americans either unemployed or underemployed, 5.4 million Americans who have been unemployed for a long period of time, and the weakest recovery literally since the end of World War II. Those are the economic circumstances we find ourselves in today. And now we have proposals coming out of the White House, in addition to the burdens imposed by Obamacare, that would lead to higher taxes on the very people that we look to get us out of this economic circumstance, and that is our small businesses, our entrepreneurs, all of whom are going to be faced with higher taxes because of the President's proposals. Mr. President, we can do better for the American people. We can get this economy growing again with common sense health care reforms, common sense tax reforms, regulatory reforms that lower the cost and the burden of doing business in this country, an energy policy, a comprehensive energy policy that will make sure that we're developing our own energy sources in this country and getting federal spending under control. We need a smaller government, federal government, Mr. President, and a bigger, more robust private economy. You cannot do that by continually piling more taxes and more regulations and more mandates and more requirements on the very people that create jobs. The American people deserve better. We can do better, Mr. President. I yield the floor.